All right, well, let's get started. Once again, thank you everyone for attending meeting 3B for the Health and Education Advisory Panel. This is going to be pretty similar to meeting 3A, where we largely focused on the healthcare side of things. So for the first hour today, we're going to really be focusing in a similar manner on the education side. And then spend a good part of the second half of the meeting talking through further detail around some of the programmatic areas that were identified for future focus in the last session. Before I get into the session, though, I'd like to say, Senator Erickson or Robin, do you have any kind of thoughts you'd like to share before we get going?
This is Senator Erickson. I just want to say welcome to everyone. Thank you for taking time today. I'm driving and out and about, so hopefully I won't lose you guys, but just thanks for being here and for your work.
I would echo what Senator Erickson said, and I look forward to a good conversation, just like the mental health one was.
Good, great, awesome. Well, I'll get started and hopefully I can get through kind of the preamble pretty quickly so we can get into the detail and the discussion and hear from our expert who I'll introduce in a bit. But once again, I'll go through the preamble. We'll discuss the filtering and alignment of submissions with expert input on the education side. And then once again, back up around the programmatic areas of interest and opportunities for impact, revisiting maybe at a little bit more detailed level what we talked about last time, and then talk about how we're going to move forward around hopefully a list of maybe 8 to 10 areas that we want to continue to flesh out and have, once again, within those areas would be specific submissions that we can reference as we're looking at the areas, but that will continue to flesh out and then prioritize across those areas in anticipation of the panel being able to construct the recommendation that it wants to put forward to the SPARC Executive Committee. Once again, we're doing our best from a process standpoint, a decision support standpoint. At the end of the day, it's going to be the panel that makes all the decisions around what gets presented. Just, to go one more forward, please. Just to kind of review, we keep coming back to the slide, but this is kind of a graphic illustration of the process that each one of the panels is going through. Health and education is a really broad topic area. And so, we've kind of sent a lot of information and pre-reads to everyone to try and help everyone get a full understanding of the full landscape for health and education in Kansas. And we're continuing to do that today. Once again, the intent was to bring lots of information to the table in order to be able to generate ideas. Some of them were the idea submissions. Others were looking at other information sources, other bodies of work that have been conducted around each one of these areas, and the brainstorming of the panel itself. So there are a lot of things feeding into this. We're right at the point now, though, where the panel has also identified some ways it wants to think about filtering some of the areas. And we're going to continue that discussion so that we are basically understanding, okay, here are the areas of greatest needs. And here within those areas are the levers that could present the best opportunity in Kansas to have make a catalytic difference in those areas for Kansas going forward. And then I talked through it before. Once we do that, then we can prioritize and the panel can put together the portfolio. So that's exactly where we are now. I've talked, kind of given a little bit of overview about this a few times. What we're doing now is kind of trying to bring the focus in so that in session 4, we can have that kind of prioritization focus. And then eventually the panel can shape the recommendation it wants to put forward to the SPARC Executive Committee. On the next slide, keep going, next slide. You'd seen this a couple meetings ago, but basically, we had broken down the entire playing field here in health and education along the kind of vertical axis of areas within health and education, from early childhood development all the way through to senior services. We added disability services and senior services as we went. So that was a good add on the part of the panel. And then we kind of looked at the areas of needs that fell into kind of baseline needs, more capacity-oriented needs and enablers. And then what we're able to do is to focus in on the information that we could bring to bear against those areas, as well as to profile and slot where the submissions themselves fell into those areas. In the last session, just to remind everyone, we had come up with kind of 5 areas where the panel had identified these are the areas that we want to explore and craft programmatic areas around. Once again, the submissions themselves don't go away, they're still there. But one was supportive employment and housing. The second one was community-based resources and services navigation. Other one was pipeline development, facility or program expansion, and telehealth. Those are the things that we heard in the last session. And we've been continuing to kind of put some thoughts together around how to flesh those out. The other thing that came out of the last session was deciding that, it seems like a lot of these themes actually, transcend any one of those individual areas. They're kind of cross-cutting programs. And so we've been beginning to think about them from that perspective. And for instance, on something like pipeline development, the thought is, given the funds that we have, and if we really want to have a long-term catalytic impact on Kansas, thinking about that, in that way, to the extent that the pipeline across all the areas of healthcare are common, and we could come up with some common solutions, might be a way to really be able to have some major impact catalytically. But we'll continue to test that as we go. Go to the next slide. The next slide, once again, is just making the point again that we are continuing the program shaping. The first half of this hour is going to be around education, and then the second half revisiting where we ended up on healthcare. Go to the next slide. I'm sorry if I'm rocketing through this. I just want to get to the meat of it fairly quickly. So now we're going to dive into the core of the education topic. So on the next slide, just to remind everyone, these are the filtering criteria that we used, and we deployed them when we went through all the healthcare topics and really profiled the various areas against these. And so we just continue to do that in the education area as well. So you'll see these filters applied as we go through each one of these topic areas. Go to the next slide. And the other thing I will say, which I kind of revisit every single time, is we got to make sure that, as the recommendations go up to the Spark Executive Committee, they're going to be looking against the recommendations from the 4 panels in the context of the guiding principles that they put forward for how they want to think about investing the Spark funds. And once again, prioritize sustainable programs and investments through one-time use of funds. So something catalytic rather than something that's going to create a substantial expansion of existing services. And if you look at the healthcare specific panel principles, you as a panel articulated that as well, combined with with leverage local and agency funds to maximize use of discretionary funds. So that could be a few things. That could be taken into account. There are some areas of need, and there are lots of areas of need, but some that may have some funds being addressed to them right now may not be sufficient, but that can enter the calculus as we think about it. And also, if there are opportunities on things that we want to focus on, even if there are some local funds that can be leveraged, think about being able to look for opportunities to leverage those. So for instance, And maybe this is more on the efficiency and modernization side. If there are grant programs, having a match included, for instance, or in terms of broadband, that's another consideration there. So making sure that we kind of leverage these funds as much as possible. The third one I'd say is the most important, and this is why we're taking such a strategic focus on this, rather than just going through individual submissions, really thinking strategically around the needs and the opportunities in healthcare and education and all the panels areas, so that we focus in on fostering a long-term systemic impact for Kansans. So looking 10 years from now, were the decisions that were made here and the subsequent investments things that kind of really change the game for Kansans for the better over the long term. Consider equitable opportunities and outcomes. And, we are looking at being able to profile, each one of these opportunities against that, enable flexibility within the investment strategies. So in some cases that may get into kind of how you shape the programs. In some areas, you may know very specifically the types of things you want to focus on. In some areas, there may be allowing flexibility for learnings down the road. And then finally, ensuring results are measurable to enable tracking and transparency. And we've even extended that into this process itself. And that's why all of these meetings are, streamed and recorded. So once again, the health and education panel principles build on proven interventions and expert recommendations. So based on that guidance, we've been making sure that we've been looking wherever there's a body of work where recommendations have been made in some of these areas already, to overlay those as we're thinking about each area, and also to bring in experts like we will be today. Make sure that we're doing things where it's allowable given the constraints of these ARPA funds, and also where existing funding is insufficient and limited. So not necessarily shying away from areas where there's been some funding to date, but taking into account how much funding has been there and how big that gap could be still in important areas. Investment should support statewide long-term transformation versus short-term solutions was something that the panel had mentioned. And once again, as I mentioned before, avoid establishing programs requiring ongoing funds. So I apologize that I spent a lot of time on that, but since I think that's kind of like the guideposts for how the panel wants to think about the opportunities here, just want to make sure that it's top of mind for everyone as we continue on. Go to the next slide, and I promise I'm going to try and stop talking soon. So the pre-reads went out, and the pre-reads included an awful lot of information, as well as filtering and expert resources for all of the education topics. So wherever possible in this discussion, I'm not going to try and rehash at any great level of detail anything that went out in the pre-reads, but just acknowledging that there's a lot of information generally in this space, and a lot of information has been shared. So jumping to slide 11. So just to give a little bit of context now, as we're talking about education, there are a lot of expert sources that we tapped into in addition to the expert we're going to hear from today. The pre-reads had gone out, and we also tapped into expert perspectives deployed, just so we get a better understanding of the size and nature of the gaps in the submissions. So a few specific things we looked at, all in for Kansas Kids Early Childhood Strategic Plan, Child Care Aware 2020 Child Care Supply Demand Report, and the Governor's 2021 Commission on Racial Equity and Justice. So what we did is we overlaid that into each one of these areas so that we can understand, what types of interventions or recommendations have been coming out of those areas, as well as the submissions. On the next slide, I'll introduce Kelly Davidoff, Executive Director, Child Care Aware of Kansas. So I'm still going to go through a few more slides, but thank you very much, Kelly, for volunteering to be here with us. Our goal with Kelly is that she can provide her perspective on the landscape, what's happening, engage in open discussion on early childhood development in particular, opportunities, trade-offs to consider, and then, have a discussion with the group. I just have kind of a few more slides to set up that discussion, but, and then I will hand it over to Kelly for a while. But once again, Kelly, thank you so much for taking the time to be with us and sharing your perspectives. So starting with early childhood development, and we broke this into early childhood development, where Kelly is specifically going to be focusing, and then later on K through 12 and higher ed. Just at the highest level in terms of looking at early childhood development against the filtering criteria, and I believe you've seen this, what you see generally is this is a place where, there's a path to allowability for majority of the, or most, if not all, of the submissions. There has been some funding that's gone into this area over time. A question in terms of how much of the funding was really just trying to help people weather COVID versus things that are going to kind of make a sustainable difference in the long term. Of the submissions themselves and many of the interventions that have been cited in some of the other work, majority of them are one-time submissions. In terms of the panel principles, it seems like there's a broad need. And in terms of evidence of need, I mean, this is an area where ever since the start of this, we said, this is an area that's of critical importance to Kansas. Heard that in the listening sessions, not only just in terms of this in and of itself being a need, but also it impacts other areas like, the economic revitalization, people being able to work because they have access to childcare, as well as it's an area where Kansas has historically lagged against other peer states. So slide 14, and I'm not going to try and go through this in a lot of detail. And my guess is when Kelly talks, she'll be able to provide a decent perspective on how to think about this. But there has been, over the course of the last couple of years, a decent amount of funds going into kind of the childcare area, with a lot of it really focused around availability and affordability. The question in that area is, has that been enough? Has that really kind of set this area up for success in a different trajectory or not? Once again, I'm not an expert in this area, so I'll leave that up to Kelly to talk about and provide her views on, and for us to then discuss on the other end of her discussion. And just to, though, before I hand it over to Kelly, give a high level overview. When you look at the submissions that we received, we received them in pretty much all of the areas from basic needs through data and systems, which is fairly similar to a lot of the other areas we've looked at. A lot of the funding, though, would probably be around the workforce, the submission requests for funding around the workforce and availability and affordability area. And so with that, I will hand it over to Kelly. And so once again, kind of reiterating the questions that, we wanted to be able to kind of get her perspective, and she's prepared to give it around understanding the landscapes, things to be critical address, gaps in existing programs and available funding. Are there opportunities in her mind for broad solutions that can foster some long-term systemic impact? And then how could the panel think about opportunities and trade-offs for one-time investments? So with that, I will thankfully stop talking and hand it over to Kelly. Thank you.
Well, thank you, John, for the warm introduction, and thank you to the committee. I'm really thrilled to be able to join your conversation today and lend the perspective of Child Care Rep Kansas and the network of child care resource and referral agencies that we partner with. As John mentioned, I'm Executive Director of Child Care Rep Kansas. And just a little bit of a context of the work that we do as a network and as an organization. We do three main things. We work to connect families to available quality early care and education. We provide coaching and assistance directly to child care providers in the state of Kansas. And we partner with communities to tackle the lack of affordable, high quality early care and education, and hopefully in ways that meet their local needs. So again, I'm really just pleased to join your conversation today. And I know that you're talking broadly about early childhood. I will likely focus my comments and my discussion more closely around childcare specifically, as that's sort of the work that we are focused on. So thinking about the landscape of needs, I think you can take two perspectives here. Considering what childcare looks like for parents, as well as what it looks like for actual childcare providers who are in the field doing the work every day. So for parents, we have a couple of issues that we're facing here in Kansas. First off, we have a supply issue. Childcare is often not available at all, or there could be a mismatch between where care is available and where it's needed most. We also have a cost issue that's facing parents. So the childcare that is available is often not affordable. And I really want to stress that this is particularly true for the cost of infant and toddler care. And I'll talk a little bit more about that in a minute. But beyond that, childcare subsidy is pretty vastly underutilized in Kansas. And so while we've done some work to expand eligibility for that service, we have some challenges, I think, to face in terms of why or why not parents may access that assistance and what that means for offsetting the cost of care for families in Kansas. So put those two issues together. When you have access issues and affordability issues, it really makes the idea of choosing a quality childcare environment that meets a family's unique needs quite simply not a reality. Choice really isn't an opportunity. It's not there when childcare isn't there, period, or when it's out of reach for families. So that's a little bit about the family perspective. Now, thinking about this from the childcare provider perspective, childcare providers are essentially small businesses. They are mostly small, independently owned and operated businesses. We do have some larger childcare centers that could be corporate or nonprofit, but by and large, the vast majority of childcare in Kansas is family childcare, which is small businesses. So when you think about this challenge, we have a profit margin issue that we're facing. This is, again, particularly true for family childcare. And I also want to highlight that family childcare is particularly crucial and such a huge asset when it comes to thinking about rural communities and tackling this from a rural perspective. So profit margins for these small businesses are essentially razor thin. Childcare providers literally can't afford to make any less than they do right now. And on the flip side, parents can't afford to pay more. So we have a mismatch there. And this has implications on a number of things. So first of all, it has implications for the income that a family childcare provider can expect to earn by operating this business. It also has implications for what a center-based childcare program can afford to pay their staff. Then thinking about reinvesting in the business. The revenue that's left over after covering the basic cost of operations usually doesn't leave much for childcare programs to reinvest in quality improvement measures, things like high quality curriculum, toys, the other equipment that really help make a childcare program a high quality learning experience for young children. It's also important to note that it costs, again, more to provide care for infants and toddlers than it does to preschool age children. So if I'm a small business and I'm looking at ways to maximize my profit, I may not be particularly incentivized to take on infants or toddlers when I know that's going to eat away at my bottom line. And I think that's a really crucial part of the conversation when you think about the current landscape and what needs there are. All of that also leads into a workforce issue that we have on the childcare provider's perspective. So this looks a little bit different depending on what type of childcare program we're talking about. For childcare centers, Currently, we see pretty chronic under enrollment across the state of Kansas. We have the facility infrastructure there. We have space, we have licensed capacity, but many of our childcare centers aren't able to enroll as many children as they would normally because there aren't staff to actually provide care for the children. So we have a staffing shortage. Childcare centers are also experiencing pretty high turnover these days. This can have negative impacts on child development. And yet childcare centers often aren't able to pay more for the staff or to think about other ways to retain the staff that they have. They may or may not be able to provide benefits for their staff. For family childcare, we've already talked a little bit about their profit margin issue, but beyond that, these programs often face decreased revenue when they can't operate. And they might not be able to operate because of illness or needing to take time off or any of the other things that we might expect a small business to be able to weather. So it's really hard to float those operational expenses and losses in revenue. And it's been particularly hard to do that in our current landscape with the pandemic. The workforce shortage in Kansas compounds this issue for family child care providers because there's simply no one to step in as a substitute. We don't have a pool that's ready to step in and relieve family child care providers. And it leads to increased stress for our workforce, loss in revenue when they can't keep their child care program open for whatever reason it might be, and just, again, really put stress on their overall ability to earn a profit. So even beyond that, the vast majority of family child care providers also don't have access to benefits like health insurance or a 401k, or the other things that we typically think about when we're talking about trying to build a robust workforce. So what does all that mean in terms of gaps and opportunities that this committee is facing? I think you've got an array of solutions that have been proposed for your consideration. And I would offer maybe 2 key points to keep in mind as you're thinking about that. First off, bricks and mortar type of solutions, facility infrastructure solutions have to go hand in hand with the workforce solutions. If we address only the physical infrastructure side of things, and we don't tackle the workforce side, we'll end up with wonderful, beautiful childcare facilities that are under-enrolled because there aren't any staff to actually provide the care, and it could potentially just exacerbate the challenges that we're already facing. On the other hand, workforce solutions are complex at best, may or may not be palatable for whatever reason, but I think with the right mix of solutions, Kansas can have some pretty incredible long-term impact on the childcare landscape. So as you're looking at these things, I would recommend honing in on opportunities to look at pipeline development. And I know John mentioned that a little bit. Thinking not only about how we're recruiting and preparing new workforce participation, but what it is we think will attract them. We need more teachers in childcare centers, and we also need more small business owners, which are family childcare providers. So asking ourselves, why would anyone want to go into this business is a pretty important part of the conversation, I think. So I also really, really want to stress that there's a lot of opportunity to think about workforce solutions that include space for the private sector to contribute. This could look like co-developing community-specific childcare solutions, potentially offering childcare as an employee benefit. At the community level, looking at different solutions. I think there's a lot of opportunity to creatively engage the private sector and have a really strong partnership between what we can do publicly and the role that they can play in the private sector. I also think it's worth some conversation and thought about how to incentivize creation of the right kinds of care and a diverse array of care. Family choice is pretty important in our world anyway. And having the ability to choose care that meets unique family needs, whether it's evenings and weekends you need care, or childcare that is particularly suited to serve children with special healthcare needs, or a different language that's spoken. There's a number of different things that go into creating a really strong experience for both kids and families when they're choosing childcare. And so not thinking about it just in terms of the traditional 40-hour-a-week work week, but really thinking about the full array of childcare options that can meet the diverse family needs that we have across the state is pretty critical. I think we can look at creative ways to offset the cost of care for families. Childcare subsidy is one piece, but again, how do we look at that on the private sector side of things? Are there other opportunities to improve the ability of these small businesses to generate a profit, while also not sacrificing the high quality early learning experience and the health and safety of kids in care? That's a key piece of the conversation as well. And before I kind of get into a little bit of what we currently have happening with current investments, I just want to share from a higher level perspective. Childcare is very much a local challenge that requires local solutions. And at the same time, it's a really big, complex system level issue. And I think this committee has opportunities to package solutions that hit both of those levels strategically. So how do we do this from a local perspective and make sure that it really meets the unique needs of diverse Kansas communities while also bolstering some of the bigger systemic approaches? I think the slide that we're on here, you can see some of the current investments that are going into the childcare sector. And all of these are wonderful and very much needed. Maybe the point that I would highlight is a lot of the investment that we've made already in Kansas has served to sustain our existing infrastructure. It's kept the lights on and the doors open. But where's the opportunity for this committee to get into creation of new childcare and really to support some of those things beyond just simply sustaining current operations, keeping the lights on, keeping our existing workforce there? I think we still have some gaps in terms of sustaining the current workforce. We've done some good things. We have opportunities to do some additional things, but then also thinking creatively about how to create additional capacity for childcare. So maybe I'll stop there, John, if that's okay. And I'll follow your lead in terms of questions or where else I can be helpful. But again, thank you so much for the opportunity to share our perspective.
Great. Thank you so much, Kelly. Rather than kind of right away kind of diving into kind of each one of the areas, I would just open it up and ask, does anyone have any questions for Kelly after hearing her talk?
This is Robin. This is not really a question. It's more of a comment. It seems like it's the same issues that we talked about in our first session. It's facilities and workforce.
Mm-hmm. Yep.
Yeah, this is Renee, and I know we talk a lot about workforce needs, and there's so much competition for the limited workforce that we have. I don't know, I recognize the need, I'm just not sure. Are there examples of other states that have successfully addressed the child care issue effectively? I'm just trying to think outside the box here.
John, do you want me to tackle that one?
Oh yeah, I don't know
Okay.
much about this at all. So yeah.
Sure. Sorry. I think there are some really innovative examples in a lot of different states. I don't know that anyone has found the magic solution or the silver bullet, if you will, but I do know states are trying a variety of sort of multi-pronged approaches. I've seen quite a few different examples of like the sustainability funds that we have here in Kansas, but also offering differential payments on top of that to incentivize particular types of care. We've seen a lot of pretty innovative strategies around recruitment and retention bonuses or wage supplements, things to kind of offset the compensation piece of it. Some creative strategies around just focusing on community capacity building and really thinking through from a local perspective what kinds of care needs to be created and how to attract potential workforce participants, small business owners into the conversation. Other ways to really connect the business community to investing in childcare as part of a local solution and part of how they provide benefits to their workforce as well. Yes, I think every state is in the same position as ours, trying new strategies, finding some successes, and also just continuing to explore opportunities for growth and investment.
This is Senator Sykes, and I agree with Kelly, but two states that I have really kind of honed in on and think are doing some great work is North Carolina and Washington State, and they've taken different approaches. North Carolina specifically, I've visited there and just with their business communities and how they're engaging in that.
And what would they be doing? Do you have a feel for, what their solutions are that they're trying out?
Kelly may be better than me, Vince, but I know Washington, they have some pilot programs that they implemented 2 years ago, maybe it's 3 years ago now, and I actually need to do an update. But in North Carolina, some of that was tax credits, which actually we just passed in the Kansas Senate, thanks to the support on an amendment on a bill. But really, it's engaging those businesses as they're coming in and investing in childcare or partnering with the community. Like some of it was programs that are already started, but actually just partnering with them. So it is kind of that combination. And I don't know, Kelly, if you can get more into the weeds than I am.
I will admit I don't know the particulars about the approach North Carolina is taking, but as you were speaking, I don't know that I mentioned this, but we do have some work here in Kansas underway through our Child Care Health Consultant Network to support and recruit new professionals really through the entire licensing process. So really, it's meant to be a little bit of a coach as potential childcare providers are exploring whether or not this is a career opportunity. We support them through the licensing process. We have some very small, limited one-time startup funds just to even get things up and running in terms of, like a very small startup stipend, not enough to open an entire childcare program. So we have some things that we're just trying out here in Kansas on that front. I know that there's a lot of good work being done in Kansas on the community level with a variety of partners, public and private, to think through, and philanthropy as well, to really think through that local perspective. One thing, I think you actually have this maybe in your pre-reading materials, but Iowa has something called the Child Care Challenge Fund. And this is a program I know a little bit about, being a former Iowan, but it is a publicly funded match program where communities can raise a certain number of dollars and draw down a state match once they have their community plan in place. And it has already shown pretty promising results in terms of creating childcare slots. That's a little bit of the infrastructure side. And I think I was also working on the workforce side through some recruitment and retention bonus measures. Trying to think about some of the other states. There's quite a bit out there. So lots of really innovative strategies.
I think as Kelly was talking, I know North Carolina, it was that licensure and helping them get extra things so that they're increasing their pay because of education and stuff, and kind of, it was a joint committee. I would be happy to do some more research on that. Sorry, I've had a lot going on.
Thank you. A question, when we look at the slide that we're on now around, and sounds like the workforce is important on the availability and affordability side in terms of generally what was in some of those submissions around things like private public partnerships and acceleration support to expand childcare capacity. Are there examples of kind of consortia of businesses rather than creating each individually their own childcare capacity, just partnering to create something for the community?
I think there's some really pretty interesting examples in Kansas. It's not necessarily that each community is creating their own thing per se, but really thinking through from a community level what type of childcare they need that is going to best meet their community's family needs and be sustainable. So when you think about the diverse communities and geographies in Kansas, what works in a frontier county might not work in a metropolitan area, and vice versa. If you think about rural communities, it's difficult to create a large child care center and fill it and staff it and keep that sustainable. But family child care is an incredibly important part of the solution for really rural communities. And I would be the first to argue that quality can be the same for family childcare as well as center-based care, and that both can really meet the needs of young children. So it's really supporting communities and thinking through what kind of care they need to build and how much. You don't want to invest a ton in creating too much childcare capacity based on projections for a young child population. It's really trying to find that right balance and then bringing together the right partners, whether it's business, economic development, local philanthropy, bringing existing childcare providers into the conversation and supporting that, helping communities learn from each other about what's worked and what hasn't. So as some of this work has gotten off the ground in Kansas, we've seen really exciting examples, everything from a nonprofit community childcare center, and we've got some pretty high profile examples in Kansas, to school district supported childcare programs. Some are coming under existing nonprofit social service agencies. Some are really developing that small business perspective of family childcare owner operators. There's a diverse array of solutions. Sometimes larger employers are getting into the mix and opening up their own childcare facilities as well. We see that with hospitals. We see that with big industry in a community, and they have to be a part of the solution if they want to recruit their own workforce. And communities have to be part of the solution if they want to retain young families and have vibrant, thriving communities. So that's, I think, the important part about focusing on the community capacity building work, and how that leads to really unique but well-fitted solutions.
Well,
This is Senator Sykes one more time. And I would say the Children's Cabinet, which now I was on that, now Senator Erickson is on it, but they've done a lot of that compiling of information and actually really dug into what each of our communities need and want. So I think that's a really important part as we're looking at this, to make sure we're reaching out to the Children's Cabinet to see where is that investment already happening, or what are the needs there.
Well, I mean, to take the discussion forward, just in the interest of time, there was a lot of information that was in some of the pre-reads, but actually in the subsequent slides, move forward a little bit. We actually kind of overlaid, various, recommendations from various sources against each one of these areas. So my suggestion going forward, and we can then, when the panel chooses an area to go deeper in, we can certainly focus on that. What might be helpful now is to kind of go through these kind of similar to what we did last time. And maybe I'll give everyone maybe a minute or two to kind of read this. and then come back and say, and once again, realize that there are needs probably across the entire spectrum here, but get to an understanding of, which areas do people think are maybe the most important, given all the pre-reads and what they've seen, and in some areas, the expertise that they have in this area, and which potential interventions might be the ones that people feel might be the most fruitful. Once again, there are going to be 3 slides. This is basic needs and access and awareness. Haven't been hearing a lot of stuff there. Later is going to be workforce availability and affordability, and then finally on the kind of data and systems integration side. But I guess go back, a couple. If people could take a minute, look at this, and then we can have a quick discussion around it. Once again, these areas had some submissions around them, not had a decent amount, but that isn't where the conversation's been going at this point. But take a look at it, and then we can discuss and then move to the second and third slides. So once again, there are submissions against all of these. So there are obviously needs. The question here is, kind of given this set of funds and the limited set of funds, the guiding principles against it, do either of these areas or these interventions kind of stand out for folks as to the thing that the panel wants to focus in on? Senator Sykes, looks like you might be getting ready to make a move.
Yeah. I think I will tell you, I have not read all the pre-readings, so my apologies. But I really, home visiting services, I mean, if we're kind of looking at some of these, I mean, that's a good bang for your buck. And if that's something to consider, because you can, I think, do a lot of preventative help in that area. But Kelly is the expert here.
Is that an area that isn't being focused on that much through some of the other things that are in play, Kelly?
So I don't know that a lot of our existing investments in childcare would touch on home visiting. And I'm not sure that I'm well positioned to speak on whether other relief funding have gone into home visiting services, but I do know Kansas has some robust programs, evidence-based home visiting programs in place already. And I agree that they're pretty impactful in terms of family outcomes across several different models.
Okay, well, let's go. I mean, we continue to keep this running. Go to the second slide. Why don't people, in a lot of our discussion was around workforce and availability and affordability. Once again, take a minute, look at it, and then we can have that same discussion around other particular areas. It sounds like both of these were areas of interest and leverage, in particular interventions that might be, some high opportunity areas. Any thoughts?
seems to me that workforce training center and pipeline development's got to be a focus because we just don't have enough people going into this particular career path. And then the private-public partnership, that seems to be a really solid way to move this forward more quickly than just trying to get lots more people to choose to start a business for childcare.
Mhm. Any other thoughts or reinforcements?
I would support what Robin was saying.
Okay.
I support what Robin is saying too. I'm trying to find areas that seem to me opportunities where we can draw some sort of broad strokes and, you know, kill more than one bird with a stone. And I know we haven't been presented with a lot of housing opportunities. I think that's because of how the different task force or advisory groups have been segmented. But I do think that workforce housing is a solution that would meet a lot of these different needs because it would free up money for people. It would establish equity in homes. We're talking about affordable home ownership, which creates access to capital. And so for all your low wage earners, whether they're in childcare or behavioral health or what have you, that's a solution. But aside from that, I'll get off of my soapbox. Workforce training centers and pipeline development, as Robin was saying, is sort of a common thing that we're hearing about, behavioral health, early childhood. And so, you know, I don't know if the centers need to be so particularized to one thing or if centers can be established to meet a few needs. That sounds like an opportunity. And sort of the same point for the public-private partnerships and acceleration support to expand childcare capacity, behavioral health capacity, all the capacities.
Thanks, McLean. Senator Erickson? Okay. All right, move to the next slide. Once again, same drill on the data and system integration. I hadn't heard a lot here up until this point. But take a look at this, and if there's anything that really jumps out at you, you know, we had mentioned the expanded telehealth services. You know, we captured that as an opportunity earlier. I'm not exactly sure how that impacts this space, but that is something we've captured.
I just the integrated early childhood data system, and I know there's work on that again, so not sure what to do there, but I mean, that's really helping kind of let us get the inventory of what we need and where we have those. So it would be interesting to see what, based on what we are currently doing in the path forward, that if there are ways to help accelerate that.
Okay. Any other thoughts in this area? All right. Well, you know, thank you again, Kelly. You know, one thing I'd say is this is actually, you know, we're going through an awful lot of stuff, just like we did last time, kind of some broad areas. So really trying to find some just kind of key leverage points and areas of greatest need here. And, you know, as a result, there'll be a lot of things that we don't focus on. The team in the background, by the way, has been kind of keeping track of where we seem to be honing in some areas, and we'll revisit that at the end. So, and have a discussion around that. But in order to kind of continue moving, why don't you head to the next slide? Let's see. So now we'd be going into K-12 and higher education, which we haven't even touched up until this point. So, Yeah. In terms of K-12 and higher ed, it's a little bit of a different situation, once again, from an allowability standpoint, path to allowability. Alternative funding, there have been a lot of funds that have gone into the space over the last couple of years. A lot of them have gone directly to schools. So not exactly sure, in terms of which areas, in some cases where the funds, what they've been applied to or how much of them have been around just dealing with the emergency versus, something that's more systemic. In the investment type, a lot of the submissions represented ongoing needs, but, opportunity certainly would exist around some things that could be catalytic. Evidence for need. Obviously there has been funding that's gone in here, but, still maybe some need in this area as well going forward for sure. So go to the next couple slides, and we haven't gone quite as deep in this area, but in terms of K-12 and higher ed, there are examples across that entire spectrum of basic needs to access and awareness, workforce availability and affordability, and data systems and integration of various states applying some portion of this set of funds against interventions in K-12 and higher ed. And so here are some examples of what those are. And once again, even through this set of funds in Kansas already, there has been some grants around learning loss, for instance, around this. And go to the next slide. If you look at it, and here are some examples over the next few slides, for instance, North Dakota, an example of some of the things that they focused on with the funds. But one thing to note, if you look on the right in terms of potential percent of total SFRF funds, typically it hasn't been the highest percentage in terms of where they focused the SFRF funds. Excuse me, hasn't been against this area, at least as far as we've been able to see to date. Once again, every state hasn't allocated all their funds either. But if you go to the next slide as well, you'll see some more examples from other states. Virginia, allocated some of their funds, $100 million against need-based financial aid for in-state undergraduate students. So there, but not necessarily big dollar amounts when you look at as a percentage of total SFRF. Go to the next slide. And when you look at this area in general, this wasn't an area where there were tremendous amounts of submissions, but it comes out to, or either in terms of number, but certainly in terms of the size. Now it is skewed a little bit. It's $1.1 billion total. The $1 billion on the workforce side is driven by one submission, where the idea was around needing to focus on pipeline development for the education workforce. And so that was really more of generally an idea and saying that was kind of a systemic need. So, but if you had taken that out, you would be at around $100 million of funding requests here. So generally, it hasn't been the area where most of the focus in terms of just numbers of submissions and dollar volumes of submissions has been. Go to the next slide. And I believe this is the last one for this section. So we don't have an expert to talk in this area, but here's kind of how the submissions generally broke out in terms of the nature of the submissions against basic needs, access and awareness, workforce, availability and affordability, and data and systems integration. Why doesn't everyone kind of take a couple minutes to look at this, and hopefully you had a chance to see the submissions as well. And then let's talk a little bit about whether there's anything here where people see kind of that intersection of, really important need and a promising potential lever, intervention point that would be well suited for, this process. Any thoughts? By the way, I realize I'm requiring you all to read pretty quickly, so my apologies. I guess one question, depending upon the intervention, do we think there's a pipeline issue here as well? And in some ways, is it similar to the pipeline issue on the health side, where some interventions might, you know, work across both of them? Or I realize it's pretty different skill sets.
I would say yes, there is a pipeline, and also making sure that teachers are representing the groups in which they're teaching, making sure that students are seeing themselves in that field of study as well.
Mhm. The other thing is, would you think about workforce in K through 12 versus higher ed a little differently?
I think that's a good question, John, and I don't know the answer to that, but from a health perspective, I know that oftentimes the workforce for healthcare is impacted by the lack of educators in higher ed settings.
Mhm.
So nursing, for example, not enough
Oh.
nursing instructors, so they have to limit the size of the class in schools of nursing.
Got it. Okay. Mhm. So I guess, kind of in general here, I'm not necessarily hearing, once again, lots of needs in this area as there are in all, lots of submissions, all of which are important in and of their own right. But I'm not necessarily hearing kind of there might be kind of a really important need that might offer kind of be a candidate for this specific set of funds to do something catalytically. That could be game changer, but correct me if I'm wrong on that.
I wonder if it's fair to say there's been more funds that have flowed into these areas through other parts of the stimuluses that have passed than the other areas that we have been reviewing and discussing.
Okay. Well, the thing I'd say is we're going to revisit kind of as we've been building this out as we go, and just as we're at the end. So if things come to mind, we can certainly think about them as we're working on our process of honing in. But with that, my suggestion is let me give everyone kind of a 5-minute break before we start diving into revisiting kind of some continued work that's been done around profiling some of the programmatic areas and how we might define them in terms of what came out of last time. So let's go to like 5:10 and then kind of regroup. All right, let's try and start up our conversation in about another minute. Thanks. And can we move the slides forward to slide 30, please? Thanks. All right, if we can get going again. Everyone back? Great. So what we're looking to do now that we've had a chance to have some discussion around the education arena is circle back since the last session when we kind of narrowed in a few areas to really explore more in the healthcare arena, have continued putting some work together and bringing some more information sources together around those 5 areas. So once again, the 5 areas were support healthcare workforce pipeline development, meet basic needs for supportive housing and employment, expand community-based resources and resource navigation, support facility and program expansion, and expand telehealth access. Now, once again, these are the areas that we want to continue to put more meat on the bone around shaping programs. And eventually the panel itself will define what those programs are and what's in those programs and be able to look back at the submissions and be able to do a relative prioritization exercise in addition to the areas we continue to flesh out that we talked about just now, in order to kind of come up with a prioritized view of really where to focus its recommendations. So the next few slides for each one of these 5 areas will represent kind of a next step for this panel to react to against each one of those areas. So you'll probably get a better feel for it as we start walking through it, but go to the next slide. So this is what that looks like for the workforce pipeline development. And what the team did was to take, okay, here are the submissions, or at least the types of submissions that fell into that area. So in the area of workforce pipeline development, there were submissions that dealt with it on the behavioral health side, as well as the health side, as well as the disability services side. They may have been kind of different types of submissions, but generally they're on workforce pipeline development. Then the potential interventions range from education assistance to training and professional development support to pipeline and career ladder development. And that led to thinking about a description for an initial program scope. Once again, this is something that the panel itself will decide in terms of how it wants to define the program that it's then going to, think about prioritizing or not. Once again, around the definition and around the target outcomes. So kind of with that, direction, I guess, take a look at this for the next maybe couple of minutes and then let's discuss. And I want to get people's thoughts around how they think about the program scope, the definition, the outcomes, and how they think about those potential interventions and whether some of those interventions would rise higher on the list to them than others. And then also, now that we're getting down to the intervention level, whether this seems like something that really is a cross-cutting program or not, or whether it really resides more in one particular area of health than another. So, before we start the discussion, one frame of mind for people to have as we go into this is there's no pride of authorship on behalf of the team around this. This is what, in all my strategy work, I would always call straw man, where you get specific enough around an idea based on some input, but you get specific enough so that people can find things to disagree with. And so the intent is, if there are things here that particularly resonate in terms of the interventions or what's being said, let's talk about it. If there are things that just seem totally wrong or people would shape differently, let's talk about that too, because this needs to be something that has this panel's fingerprints on it, not the support teams at the end of the day.
John,
Go ahead.
I have a question.
Sure.
So if we start over on the left under behavioral health and we look at scholarships, tuition reimbursement, fellowships, is that thinking about the specific requests that we got within those categories? Or is that taking a more macro level look at how is there a program to support that at a more macro level?
I believe that the panel can go wherever it wants to, but if it focused on scholarships, tuition, reimbursement, fellowships, and says that is a high leverage area to look at, then as this program continued, the submissions in those areas would be up for consideration going forward, or they might get reshaped later. But the intent is, when the programs get moved forward, the programmatic areas, those submissions that acted as some of the inspiration won't be lost. They may not fit the description anymore, right? And they may need to be reshaped by the submitters, but it isn't meant to just kind of be limited to the submissions, right? It's the judgment of the panel.
Okay.
Did that answer your question, Robin?
It did, because we've got a lot of, as you read through the submissions, there's a lot of onesie twosies, 5 scholarships here, a year of scholarships here, 3 scholarships here, which will help a little bit in those specific areas, but it's not going to help our state on a larger level.
Yeah, I think with all of this, all of the submissions, once again, we asked for ideas. In some cases, people put in things that were high level ideas. In some cases, people put in things that obviously had very specific work behind them around, as a project proposal, but it was a range. But, when I go back to what the third guiding principle was of the Spark Executive Committee, it was things that are going to be kind of game changers that can have a catalytic impact for the long term. And so once again, I think we need to respect the submissions, and if they're within the area, it makes sense. But if they're all very narrow point solutions, they may not tell the whole story of what you'd want to really try and get at if you were going to try and do something from a game-changing standpoint around a workforce pipeline.
Thanks for that. That issue is where my head kind of gets confused or argue within myself. I don't know.
Yeah. I mean, many of those submissions, if the panel ends up shaping this and decides upon this is something that's a high priority, and then it goes to the Spark Executive Committee, the Spark Executive Committee decides it too. A number of those submissions, when you get into procurement, they might actually make sense, as part of this programmatic area. So, great. And they actually did a great service by helping the panel think about it, right? But we don't want to kind of lose sight of what the big catalytic opportunity might be when we define these. So anyway, that all being said, things here that people think are, more important than others, or just, you look at the program scope, just flat out wrong. I just wouldn't define it that way. This is meant to be kind of kicked around at this point. The thing I'll say is, I guess I'm assuming that the silence is agreement that this looks really good. But this isn't going to be people's last chance in order to be able to provide input on these things. So we'll make sure in the homework, we give people a little bit more time to take a look at them as well. But once again, no pride of authorship, and definitely we want to make sure that we get this right in the eyes of the panel. All right, well, no more discussion there. Let's go to the next one. Sure, we'll do McLean. So this is the one, and rather than kind of going through all the pieces again, I'll just let people read it around basic needs for supportive housing and development. And once again, as we define these, we can kick this around, and all these different programmatic areas are going to get prioritized by the group too. So if there are some things in here where you might say, some things that don't seem as compelling to me or more compelling to me than the one I just saw, they're still going to end up getting kind of prioritized and continually massaged in the 4th and 5th meetings too. So, and in between. So I'll stop talking, take a couple minutes to look at it, and we'll go through the same exercise. So once again, and by the way, we haven't even set the funding levels on this, or the panel hasn't. I mean, if you looked at just the submissions, but they might represent more point solutions, it's at about 120 million just across those 6 submissions that follows here. That may not cover the whole idea though, or it may cover some things that people don't think fit in here. But any reactions to particularly the potential interventions in the initial program scope? So not hearing anything, am I assuming that no one has any allergic to reaction so far to anything on this particular slide? Or are there any areas that people, in terms of those 3 levels of intervention, that they see as more an area of focus or need, or maybe opportunity? All right, Sean?
This is Sean. On those couple of potential interventions, while I agree that supportive housing and the items under the left-hand box are very much needed, things like rental assistant, case management support services, case management peer support, care services under the permanent supportive housing expansion and recovery / mental health crisis housing, those all seem like ongoing funding that would raise red flags. So how is the infrastructure and retrofits or additional housing stock created, while also funding the outreach coordinators or bridging specialists that are needed to try to direct folks to get into that housing? And that was a huge question in my mind of
Mhm.
how to best fund these things. And I don't know that I don't have the answer. Hopefully others do.
Yeah, you know, and in each one of these areas, one of the things that we have been looking at for some of the other panels that have been moving forward, maybe a little bit faster rate because they're not covering quite as much, is working on when we get down to individual programs, thinking through if you'd score them against, say, impact, feasibility, and equity, if something on the feasibility side is making sure this isn't something that's going to kind of create ongoing budgetary requirements. That's part of kind of brainstorming around some of these, saying, you know, how do we make sure that we're maximizing the impact, but making them feasible? And that may mean narrowing the focus or modifying the focus of some of these as well, just to your point right then, Sean. Is there any additional? Go ahead.
As I was reading through these, I thought every one of these is needed. Absolutely needed. But it creates ongoing operational expenses that aren't there today.
Yeah. Mhm. Yeah, that is a little bit more the issue with this one. But I don't know, there may be ways to structure some of them so you can make some progress in this area without incurring that. And that's something I think we need to explore. Okay.
I would say that the caveat to that, if there's possible reallocation of funding, if by doing this, it serves as a transformative catalytic investment to reduce funding to this area. And again, I don't know what that would be, but
yeah,
I agree with Robin's point.
If there was something to balance it out. Yeah. Got it. There might be some like current ongoing costs that end up getting relieved as a result of this. And so it covers these costs on an ongoing basis. Yeah. All right, well, let's point state, let's go to the next one. Community-based resources and resource navigation. I'll give people, you know, a few minutes to look at this one, and then we'll kind of have a conversation around it. And there are a lot of things that fell into this from the submission standpoint. And I'm not sure kind of when, you know, as the panel crafts what it wants the program scope to be, whether they'd all fall in or not, right? I think some of the things the panel has touched on are certainly in those submissions, but I think those submissions may or may not cover a range of things that may have been kind of beyond the most critical things that people are thinking of, but I could be wrong. Yeah, the other point is that, you know, this one also could span a few areas, right? So these also span education and health, you know, community resource centers and family resource centers. So this may actually be something that truly does cut across a much broader swath, you know, moving from healthcare even into like, you know, the early childhood development, the childcare area too.
I was looking at just like the resource centers and facility, like the construction renovation, if that's opening up more access and kind of hitting multiple of these issues with one, like, I don't know, one use of dollars, but it's opening up because they now have childcare access, but they've got more education. And then there's also healthcare accessibility in there. Getting more bang for your buck there.
Yeah, this could be something that at the community levels, a more broad platform. Any other thoughts, reactions? Once again, anything here that people have a violent disagreement with? or even mild disagreement with? Do people have, it seemed like from the last time, I thought people might have had a little bit less interest in like the recreational facilities and other pieces of it. But am I wrong there or not?
That's the one that I struggle with the most is the sports facilities, playgrounds, athletic fields.
Mhm.
While I absolutely think those are important, and I think one of the best things we can do for kids is get them involved in teams and sports. I struggle with that, I guess, a little bit in thinking about behavioral health and education.
Mhm.
Not that it's not important, because it
Yep.
is. I'm not sure that it rises to the top priority level in my
Yep.
head.
Yep. Yeah, no, I agree. I mean, in reality, every one of the submissions that was sent in is important, right? It's just, what's the right fit for the guiding principles that we've been given around, catalytic area focus and the focus of these funds. So. Great. All right, well, move on. Let's move on to the next one. I just want to make sure, kind of we get through some of them. And, if we're going to have some more discussion, rigorous discussion around some of them, let's kind of get to them. Once again, same drill, spend a few minutes looking at this around facilities or program expansion. And there are some decent sized dollars around this, right? And very specific dollars. So. One thing I'll say is I'm not an expert in any of this. I'm not in the middle of this ecosystem. I had heard what I felt I've heard throughout this process is the thing that jumps out to me more is step up, step down facilities as kind of a particular lever that people have talked about, but I may be totally wrong in that. So open it up for discussion. Any kind of thoughts or reactions? How do people think about, in terms of the interventions, facility construction and renovation versus kind of grants for program expansion?
I think, and not looking at all I think that has some validity for it, especially if kind of there's a match or something as part of it, and not just we're footing the bill for all of it. But I think there is some validity for that construction or renovation so that they're able to better serve the community.
Sure. Got it.
I agree with her comment, because it seems like when you read through the submissions, and I know I keep saying this, but there seems to be two themes: capacity, aging facilities, and workforce. And so the facility construction and renovation, as well as the grants for program expansion. I mean, some of our organizations they need to be able to expand their services, but they just simply don't have the infusion of dollars to make that happen. Whether that's adding another room, adding a building, making a something larger.
Mhm. Yeah.
So there was a lot of submissions I thought that fell into that. We need
Mhm.
better facilities. That's one that's really easy to kick the can down the road and say, well, we'll add on next year, or we'll build that extra building next year.
Mhm.
I've been part of a lot of organizations, not-for-profits, community organizations that we just keep kicking that can down the road.
Yep. Okay.
And I think it can be a good use of one-time funds as well.
Mhm. Okay. Any other thoughts? All right, go to the next one. All right, telehealth.
So John, is this one both the tools that the provider needs to provide the service and the laying of internet access lines and things like that to make it available in rural areas?
The latter, it requires both things. Well, it requires that you have adequate connectivity in rural areas, sometimes actually even in urban areas. But you may be able to get some of that connectivity before laying the fiber there. So I wouldn't, for the purpose of this, but I wouldn't want to kind of discount that at all. The connectivity piece is being addressed through the connectivity panel. But this is, kind of, I guess, what are the other enablers that would be required? And some of those submissions reflected that. Yep.
So I absolutely support telehealth, but I also think we have to look at the other side of, even if we're putting all this in place, but they're not able to get reimbursed,
Yeah.
which is not something that Spark can deal with, but that's a legislative issue that needs to be addressed as well, and also taken into consideration as we're deciding where funds go.
Yeah, that's a good point, Senator Sykes. I'm glad that you mentioned that. There may need to be other enablers on any of these that go forward as eventually as a recommendation to say the panels should all, any of the panels identify the other enablers that need to go in place in order to get maximum value out of that programmatic area, right? Because there are probably things that exist like that in innovation, for instance, right? I mean, that is a category that we should be looking at across all of these. So that's a good point. Sean?
I think that's definitely true, what the senator said. There are also other areas, whether it be in health, senior or older adult services or disability services, where things like remote patient monitoring services or some other crisis response services, telehealth, actually, if deployed more and if resources were available to either pilot or just deploy more generally broadly, it can be a huge help on the workforce issue and can also help save on the higher end cost of just general healthcare, whether it be admissions to hospitals, readmissions to hospitals. So there are some, I thought, very good proposals to that end on some of this stuff within those couple of sectors.
Yep. Great. Yeah, the connectivity panel definitely, in some ways, is an enabler for the other three panels in terms of one, on efficiency and modernization, access to government services digitally, health and education, access to education and healthcare, and then economic revitalization, being able to do remote work, for instance, as well as other kind of applications like precision agriculture on the agriculture side. So it definitely is a pretty big enabler. It sounds though like people feel, okay, assuming you eventually get that in place, that this is a pretty high leverage opportunity, right? Because this is something that you can scale. Got it. Okay. Any other thoughts here? All right. Well, why don't we head to the next slide? And I suspect is that the summary slide where we're starting to kind of come up with, here's kind of maybe what the game board looks like in terms of the areas to kind of really continue to build around. So let's make sure we captured today what came out today. I don't know if you guys are having a little bit of a problem, but the page is getting truncated for me a little bit at the bottom. Or maybe that's just me. So anyway, if you could scroll up a little bit, so in terms of today, we just talked through the 5 from meeting 3A, and we continue to work through those. The workforce pipeline development, though, I guess at least the suggestion is that might be something to think about across all of the health and ed as much as applicable. That in access and awareness added expand home visiting services, early childhood development. Availability and affordability added expand capacity through private-public partnerships, early childhood development. And then data and systems integrate early childhood care data systems. And if there is something underneath that, I can't read it from where I am here. So I guess the question of the group would be, do those 3 new program areas capture where people felt we came out today? And I think there was a little bit of extending the workforce pipeline development line over as well, but are there things we missed or misrepresented?
Those 3 capture the bulk of what we talked about.
Yeah, one thing to note though, it doesn't represent anything around K-12 or higher ed. One thing I would mention at the very least on higher ed is that on higher ed, there are some things in the higher ed space, components of pieces of things that got moved into some of the other panels. So for instance, things like innovation campuses at some colleges, some of those submissions moved over into economic revitalization just because it was more in line with kind of economic revitalization issues. So it was kind of in sync with what that panel was thinking about. But just to note, there isn't anything here that really is linking in through K through 12 and higher ed. And didn't really hear much coming out to focus on that with this set of funds, but just want to kind of put it out there that, does it seem to people like that was a miss or not? Once again, need to kind of set some priorities and focus.
As we were talking about K-12 and higher ed, in my head, I guess I was focusing more on K-12, but really higher ed really ties to workforce pipeline development.
Yeah.
If we don't have colleges that have the appropriate campuses and services and programs, we're not going to have a workforce pipeline development.
On workforce pipeline, are you primarily thinking about, are we having the correct pipeline coming in for the healthcare space? And therefore, do we have the, kind of right on ramps from the education system as well as the right, teaching in, at the professional level for nurses, doctors, others. Are you also thinking about it as in terms of the pipeline of teachers, just teachers in general?
I think it's got to be both.
Okay. So from that standpoint, workforce is kind of touching on the pipeline issue in K-12 in a general sense.
Right.
Okay.
And we've got to focus on, we've got to think about the pipeline of teachers in colleges, because like I said a few minutes ago, if we don't have a good pipeline for teachers at universities and colleges, we're not going to end up with the workforce we need because there's no one there to educate them at that level.
Mhm.
It is all a circle.
Yep. Any other thoughts against this? Because what we'll do moving out of this is, if this is generally right, at least as far as we know here, is to continue to flesh these out and work with the panel to kind of hone them in while as well fleshing them out in anticipation of the next session where we're really going to start being able to kind of make some relative trade-offs across them and some prioritization, and then begin thinking about even potentially what kind of funding envelopes could look like. And that will partially require going back and looking at the submissions that fell into these areas. But generally, this seems on track for folks.
John, a few minutes ago, you said that some of the higher ed proposals had been sent to a different advisory panel to look at. Could we get a list of which ones have been moved out of kind of our bucket?
I think we have that in the appendix, right? If it's in the appendix, could you go to that? So let's see. Overview of 17 higher ed investigators included in Health and Education Advisory Panel. So the things that went into economic revitalization, ideas include those focused on infrastructure, workforce development, business needs, innovation. Does the next slide show specifically the submissions that fell into econ revitalization, efficiency and modernization and connectivity? Yeah, we don't have it. We can share it, follow up and go into that.
Okay.
Make sure you have it. But yeah, we've been really focusing on the back end to make sure that no submissions kind of fall between the cracks. And they're also available on the RO website. So you can see them there, but we'll reshare that.
John, I wanted to make a comment just on the teacher comment that Robin shared about making sure we have the right pipeline. I want us to be sure to have the right data as well, because teacher certifications have gone up about 200. That means the actual licensures that are given to teachers have gone up in the last 5 years by approximately 200. However, Robin's correct. The number of students that are entering the teaching profession, that's flatline. But as we make these decisions about pipeline, I would like us to be sure and maybe have other legislators that are knowledgeable in these areas and what kinds of programs and scholarships are already available, trying to entice individuals to go to certain sectors, perhaps weigh in on these.
Sure. Great idea. And that was the intent as we continue to kind of build out the programmatic templates to make sure that we're understanding kind of where these fit within the context of everything else that's happening. But point well taken. Thank you. All right. Next slide. I think we're getting ready to land the plane. So once again, I started, upon that. The team's going to work and go back and do some kind of homework work and some additional requests to the panelists in reaching out to understand the other things that are happening around some of these areas in order to continue to flesh out the program descriptions and target outcomes, and begin kind of drafting some of the thoughts about how to look at these from impact, feasibility, and additional consideration standpoint. And then we're going to be able to think about prioritization, but then we're also going to need to then make the switch a little bit and think about, even as we kind of know where these things may relatively prioritize, really start thinking about the target and the minimum asks. And there, that's going to require us, once again, going back to the submissions, at least for one starting point to begin thinking about that. Once again, in some cases, the submissions may not have necessarily captured part or all of the thought. In some cases, the submissions may actually be spot on. So we're going to need to look at that.
John, I have a question.
Yes.
It's a process question. And I may have missed it as we were going through all of these discussions and process. Will the committee ultimately be scoring the 251 applications individually or collectively, or are we approving by category, or what's the ultimate goal?
I think the ultimate goal is you're creating the programmatic areas, so you're kind of scoring by category and then looking at which submissions fell into each one of those programmatic areas. So then within, so it would say, I just want to be really clear that if something was viewed as, from a strategic standpoint, wasn't as, relatively speaking, all of them are important, but is important an area of need, or even within an area of need that was important, like necessarily the right intervention, those submissions wouldn't be getting kind of detailed scoring against them or as much view against them. It's really the ones that are falling into the areas that the panel itself has decided are the most important areas to really focus in on in terms of the recommendations. Does that make sense?
It does, but my only concern with that is that each is an individual unique project. And I would hate to eliminate an individual project because it maybe didn't have this overarching priority, but yet it served a unique need. And so I'm wondering if different committees are approaching it all the same way, or because we haven't talked about any of the individual projects.
Yeah.
So therefore, I'm a little bit at a loss at how we are, we have these overarching priorities, but some of them may fall through the cracks for various reasons. And so I hope we will have the opportunity to individually score each of those projects and then see where they fall.
We'll have to look at that. That was not the intent of this, just because we were given 13. The submissions, once again, they weren't project submissions, they were ideas, and all important, but they had a large range in terms of just a very basic idea to something that probably did have a specific project submission that may have been in existence for years, behind what was put on that idea submission form. But with $13 billion worth of submission requests, and once again, that may not even, per Robin's point, some of them are onesie twosies. That may not even encapsulate what the overall thought is. There are obviously going to be some project areas that just fall out. And if you go to that third slide on the filter.
John, may I just say that projects, actually what I'm meaning is applications. So it's not necessarily a project per se, but I don't want us to focus on the word project. Let's focus on the idea of the application. And I also would want the committee to know that in, at least on the House side, in appropriations, we have had some Democrats in particular, some Republicans they're not happy that this was not brought back to the legislature. So I want everyone to understand that that is an ongoing discussion with, one Democratic representative in particular and others that are agreeing, because much of these discussions are happening, and other legislators who are, their role is appropriations are not part of this process. So there is concern about that. And I just want to be open about that.
Yeah, and I appreciate that. And I think it's probably logical that that would be a concern, because this is probably a different type of approach. I will say it was always meant to kind of go down this path. This is the slide that we've kind of shown every time along the way around using the submissions as kind of one source of inspiration, and then honing in on program areas and portfolio areas. But we'll definitely kind of take that into account. And my guess is that if that's a discussion that's happening across multiple groups, then we're going to need to address it. So I appreciate your bringing it to the surface, Representative Williams. Great. Well, thank you. Well, with that, and that big caveat at the end, that's kind of all I think that we're going to specifically try and go through this time. The goal is going to be to try and land the next meeting tentatively on the 21st, but we'll be getting back to you around that. And have done work around the programmatic areas and some thoughts around those areas. Not ignoring anything that you just mentioned, Representative Williams. Okay, thank you.